Many people, when they think of Monterey County, they think of Pebble Beach, they think of Carmel Beach. Many times they think of the wine industry. I would hope that they would think of agriculture because we are known as the salad bowl of the world. We have individuals with lots of money that have summer homes, and we have families with very low incomes, yet are feeding the world in terms of produce. Health and Health Policies is really a framework for looking through a health lens at all impacts to health, whether it be policy changes or program changes.
In order to advance health equity, our health department has really looked at an internal as well as an external approach. Health Equity Scholars Academy, the HESA Academy, is an opportunity for our employees to learn about the social determinants of health. Employees can converse about root causes and how we can better serve our clients or customers, really through a health equity lens. In 2014, 5 cities got together with the health department and applied for the $4.6 million grant to work on infrastructure in our community.
There was a huge need to improve the access and transportation to this area because there's a lot of kids that come to school here. We didn't have the accessible pathways that we have now. We replaced all this sidewalk. It was in really poor condition. We improved these safety ramps to get into our sidewalks. We improved the access to our alleys. We made them safer for our residents to cross over.
Through HEAP, it really has given us the opportunity to work outside our field, to really sit at the table with engineers. We're learning how to speak engineering language, and they're learning about health. And so it's two completely different disciplines coming to the table with people who haven't necessarily engaged in conversations before.
We are helping our community tap into the potential of thinking big and achieving big. We have a health facility now in Gonzales. We have one young doctor that graduated from Gonzales, went away to medical school and came back and now is working at our health center. We've gone from 1 doctor to about 6, and that's going to continue to grow.
We also partner with community residents as well through some of our programs, in particular one, Enlace, which is a civic engagement leadership academy available to residents all over the county. Really what Enlace does is helps residents build knowledge about how the city's budgeting processes work, who the systems leaders are, so that they really understand the process and know how decisions are made in their communities.
Participamos en el programa Enlace, donde se nos habló de diferentes temas de salud, nutrición, de cómo saber distribuir fondos del gobierno que a veces pues no sabemos por falta de información.
A group of us with community members went to Sacramento, and we learned tips as to how to promote and how to voice if you have a passion for change.
The participants become very active in their communities and really are at the table with their elected officials and leaders.
Monterey County still has anywhere between 30 and 60,000 residents that are not able to have health care coverage because of their documentation status. Through a pilot project, our Board of Supervisors allocated $500,000 of general fund to be able to get individuals into primary prevention services so that we can help individuals practice healthier lifestyles and have the necessary care that they need.
Monterey County has really advanced in the last 5 years for a county the size of ours to really be intentional about how we're developing programs and policies and the language we use. I only see us going further from where we're at now.